Go.
Hi, my name is Alexis and I'm going to demonstrate to you how to administer medication via PCA Graesby pump. So first I'm just going to do hand hygiene, compare my physician's order with my MAR. So we have here patient Tyson ward, phin number 123456789. No known allergies. So the doctor ordered fentanyl, 10 micrograms. This is 10 micrograms per ml, lockout interval of 5 minutes, lockout interval of 5 minutes. So the physician's order and the MAR has been signed and transcribed properly, so that's good. And now I'm going to review my PDM. So fentanyl, this is fentanyl. It's a high alert medication, so I know that I needed to nurse check for this. It is an opioid analgesic, which is appropriate for a patient's condition, which is pain. It can be administered by a student nurse. So the usual dose for PCA is 10 to 50 micrograms with a lockout interval of 5 to 10 minutes. So I know that we are within the safe dose range. And for compatibility, it's compatible with the normal saline, which I have here. And I'm gonna note for any potential hazards such as nausea, vomiting, urinary retention, respiratory depression, and I know that it can be given via PCA. And as for my recipe here, for my 10 micrograms per ml, in order to get that, I would get 500 micrograms. So I needed 2 vials that has 50 micrograms per ml. And then dilute it in a 40 ml of normal saline with a final volume of 50 ml and a final concentration of 10 micrograms per ml. So now that I've reviewed that, I'm going to do my first check with my MAR, my PDM, and then my medication here, which I got from the Pixies. So first check here, we have patient Tyson ward. We have here doctor ordered fentanyl. This is my PDM's fentanyl. Fentanyl. So the dose is 10 micrograms. So in order to get that, as per my recipe, I needed 500 micrograms, which I needed 2 vials that has 50 micrograms per ml. So this is fentanyl, 50 micrograms per ml, 50 micrograms per ml, and I know it's not expired. And I have a diluent 40 ml to get a final volume of 50 ml and final concentration of 10 micrograms per ml. The route is via PCA Graesby, and then the date and time is today now. So I'm gonna do my hand hygiene, grab my 2 vials here. I would use different swab for every vials, but for the purpose of this demo, I would just use one. So I would swab 30 seconds on the top of the vial and dry for 15. Grab mine. Maintaining sterility of my supplies here. Combine them. So inject 5 ml of air on my first vial. Inject another 5 ml on my other one. 5 ml of air spray. So injecting 5 ml of air. Then I'm gonna use scoop method and then make sure that I don't have any air bubbles. So now I know that I have 10 ml here, so I'm just gonna put my label. So fentanyl, 500 micrograms, 10 ml. Have check on my recipe. Good. And then I needed 40 ml of the diluent, so I'm just gonna grab my 50 cc syringe here, maintaining sterility. So gonna open a new alcohol swab. Swab my normal saline bag. This is not expired and it is new for 30 seconds and let it dry for 15. And then I know that I have to withdraw 40 mils of normal saline. I'm just gonna double check that I have 40 mils here. Take out the air. Okay, good. I have 40 mils. Okay. So I'm gonna label this 40 mils. So I put this on my waist. Now I'm ready to do my second check with my MAR, my PDM, my medication vial, my medication syringes here, and my final med label. So we have here patient Tyson Ward. The medication is fentanyl. This is fentanyl. The dose is 10 micrograms. So in order to get that, as per my PDM, that's fentanyl. I needed 2 vials of 50 micrograms per mils to get the final concentration of 10 micrograms per mil. So fentanyl 50 micrograms per mil, fentanyl 50 micrograms per mil. And this is fentanyl 500 micrograms and it is 10 mils. Diluted in 40 ml of normal saline, which I have here, and then final volume of 50 mils. And then our route is via PCA Graesby, and then our date and time is today now. And I have signed the label, and then I'm gonna ask my second nurse to do their independent check. So my second nurse confirmed that I have the right information. So now I can inject my medication in a bigger syringe here. So I'm just gonna withdraw. Withdraw 10 mils. So just carefully, this goes to the sharps. Carefully inject my medication. Okay. So I would do scoop method actually for this one, so that we don't needle poke ourselves. And then just make sure that I don't have any air bubbles, so just I see blood here, so I'm ready to cap it with my blue cap. Maintain sterility here. Okay, and put our final label. Okay, and this goes to the sharps or med waist, and my sharps goes to the sharps. So now I'm ready to go to the patient's room with my final medication syringe here with the label, and then my MAR. So going into the patient's room, first I'm just going to do hand hygiene, do an entrance safety check, patient's not in distress, gobble within reach, bed is in the lowest position, and introduce myself to the patient. Hi, Mr. Tyson, my name is Alexis, your student nurse. I just need to confirm that I have the right patient with me. Can I please see your armband? Can you state me your full name, Tyson Ward, and your date of birth, or your, PIN number is correct. Any allergies? No? Okay. So I just need to do my third check here on your bedside. So for the third check, I'm going to be using the patient's armband compared with my MAR and my final medication here. So we have here patient Tyson Ward. The medication is fentanyl. This is fentanyl. The dose is 10 micrograms. I know it's 10 micrograms, so in order to get that, I needed the 500 micrograms in the syringe, which is 10 ml, and then diluted in the 40 ml of normal saline to get the final concentration of 10 micrograms per ml. And the route is via PCA Graesby. The date and time is today now. So it's been signed. Okay, that's good. So now it's confirmed. At this point, I'm just going to check the patient's IV side. No signs of infection, no swelling. And I'm notifying that I also have a carrier here of normal saline that is compatible at TKVO. So, Mr. Tyson, I have here your fentanyl medication to help you control your pain levels. So I would be closely monitoring your pain levels every hour, documented, as well as your do the somnolence scale, the also your vital signs, your respiratory rate. So any of side effects you should know is nausea, vomiting, dizziness, palpitation, if you're having trouble breathing. So if you feel any of those, please use your call and we will help you. And you have here your PCA button. You have your PCA button. So for this one, we already educated you about this, but just so you know that you're the only one who can use it, not your family, not nurses, okay? So do you have any questions for me? No? Okay, and then can I give you this medication? Okay, so I've done my third check, patient education. Now we're ready to go over our pump here, compare it with our MAR and our final table here, so turn it on. So our drug concentration is 10 micrograms per mil. So, and I know it's at micrograms. So that's 10 micrograms. Enter. Loading dose, we don't have loading dose, so 0. PCA bolus, I know that it's 10 micrograms. And as per my MAR as well, 10 micrograms. So it's 10 micrograms, 10 micrograms. 10 micrograms. Enter. And dose duration is 5 minutes, or which is our lockout. Oh, sorry, dose duration is 2 minutes, not 5 minutes. It's 2 minutes. Okay, enter. Lockout period, which is the 5 minutes. So enter. Continuous infusion, no, not continuous as per my label, so 0. And then the demands and goods, I'm going to document that as well and monitor every hour. And then end. And then I'm gonna ask my second nurse to do their independent check. Okay, they gave me an approval sign. I have the correct information, so now I'm ready to change the pump here. So take it out. Okay. So maintaining sterility here, so I'm just gonna carefully take out the blue core. So prior to doing this, for sure, I would also do hand hygiene just to maintain cleanliness. Okay, and then carefully transfer the tubing onto the new syringe. This goes to the med waste if there's any waste. And then for the purpose of this demo, I wouldn't actually just open it because I might break the machine, but I know I would close it, make sure to lock it, and then I've done my second nurse checked it already, so that's good. So I'm now ready to press start. I know that it's starting when I see the green lights blinking and that it beeps. And I know that I'm gonna make sure that the clamps are open. Clamps are open. I have a running TKVO, normal saline, and then I'm gonna lock the pump. Okay, so Mr. Tyson, your pain medication is infusing. Any of the side effects we talked about, please let me know. We will help you, but we will also be monitoring you closely. Your PCA button's here. Again, you're the only one who can use it. So if you don't have any questions, then we're ready to leave the room. So do an exit safety check. Patient's not in distress, callable within reach, bed is in the lowest position. And then I'm going to sign my MAR with my second nurse who did the checks with me. And that's it.